So, hi everyone and welcome. My name is Abir Ahmed. I'm a health policy analyst and I'm pleased to welcome you today to the second webinar in our webinar series on systems thinking, hosted by the SYSTAC Europe Forum team together with SYSTAC Global. Before I introduce you to our forum team, let me share the agenda for today briefly. After the introduction, we are going to start our webinar with our guest speaker for today. Then we will open up the floor for questions. So as a part of the SYSTAC European Hub, the SYSTAC Europe Forum is coordinated by a group of early career researchers and global health practitioners who have created a space where researchers, policymakers, and practitioners can connect, learn, and exchange experiences on systems thinking. Our official launch of the forum took place within the SYSTAC's informal networking event in early November 2022 at the 7th Global Symposium on Health Systems Research, HSR. So our SYSTAC Europe Forum team that I'm proud to be part of includes Amanda, Claudia, Catherine, and Sabina. So now, after you met our team, please feel free to drop your name in the chat box below and let us know where you're joining us from. So our vision as an established advisory hub is to first contribute to the adoption of system thinking approaches, and second, to shape the global health research and practice across Europe and beyond. This will only happen when researchers, policymakers, and practitioners are first empowered to adopt system thinking approaches, second, to be confident to apply system thinking methodologies needed to address global health challenges, especially during such unprecedented crises and current complexities that we see nowadays. We want to help aspiring system thinkers to be part of a peer support platform that promotes a mindset shift towards the adoption of system thinking approaches in global health, and to support the development of the needed not only technical but also soft skills. So who are the aspiring system thinkers that we are talking about? Basically, it's everyone, you and us, all of us. So in order to achieve our goal, we have some objectives that we are working on. First, to increase the awareness about the possibilities offered by system thinking approaches, to establish a peer support platform to facilitate collaboration among aspiring system thinkers, which is you as well, adoption of best practices and evidence-based interventions in global health as well. Third, to create a network of senior mentors offering guidance and support to aspiring system thinkers in global health. And finally, to support you, our target group, in their personal growth through information sharing about career advancement and offering relevant coaching opportunities. But in order to achieve our objectives, we have started planning our activities with first hosting biannual webinars where system thinking experts are invited to share and discuss the latest research and publications, hence our webinar today, and facilitate the establishment of peer body system based on matching of specific common interests. Beside the webinars, we are planning to organize also virtual or hybrid workshops and simulations and system thinking tools to foster the exchange among junior researchers. We're also planning to launch a mentorship program where aspiring system thinkers can support and receive guidance from senior experts. So what's exactly system thinking? I'm really excited to introduce our guest speaker for today. So without further ado, we're going to introduce Rachel Cassidy, who's a researcher at the Geneva Center for Humanitarian Studies and honorary researcher at the London School for Hygiene and Tropical Medicine. In today's webinar, Rachel will present key concepts and a recent application of using system dynamics for policy evaluation, with a reflection on using this methodology for health systems research. So welcome, Rachel, and thanks for joining us today. The floor is all yours.
Great, thanks a bit. I think if you close your presentation, I'll share my, yeah, perfect. Perfect. Can you see my screen? Great. Okay, great. Hi, everyone. Thank you, Abir, for that introduction and for the opportunity to present to you all today. So as Abir was saying, I'm based at the Geneva Centre of Humanitarian Studies, and I'm going to share some results from the studies that I've worked on and some information on using system dynamics for policy evaluation based on my own experiences as a staff member at the Geneva Centre of Humanitarian Studies, the London School in the UK, and a recent PhD as well. I've just had my exam. Yeah, so thanks so much for inviting me to present today. I'll give a little bit of information on myself very briefly before moving to talking about some key concepts around systems thinking and system dynamics. We'll look at some considerations for creating study design using these methodologies. I'll draw on a recent application from my own project, and we'll have some time at the end for any questions that you might have. I just wanted to point out that I work on a couple of different projects that use systems thinking methodologies. Most recently, the Sensilet project at the Geneva Centre, where we're using process mapping to look at healthcare supply chain dynamics in Ethiopia, working very closely with Addis Ababa University in Ethiopia on that project. I also work on the Pulse project, which is with the London School and the Red Cross, using causal loop diagram methodology to map community engagement for vaccine delivery in Ethiopia and Nigeria. And finally, I work on a third project where we're using causal loop diagrams and system dynamics modeling to look at pathways to impact for results-based financing programs in Tanzania. And that's the example that I'll be drawing on later in the presentation with more details. Okay, so I thought I would start. I imagine you have all heard of systems thinking and that's why you're here, but I thought maybe it would be good just to have a little refresher at the beginning about what systems thinking is and why we use it for health systems research. So we start from the position that health systems are complex systems that exhibit complex behavior. So if we think about an emergency department, for example, you have patients seeking care, you have health professionals providing care. These agent groups are interacting and making decisions based on these interactions, often in resource-constrained settings. The emergency department doesn't operate in silo. It's communicating with the primary care sector, where they're receiving patients and referrals, and also the social care sector, for example. And all this complexity is giving rise to emergent behavior that we're interested in studying. The idea here is that we need to use tools that are capable of managing and analyzing complex behavior in evaluations, such as tools that derive from systems thinking methodology. Systems thinking is an umbrella term for a couple of different methodologies, but generally with systems thinking, we're viewing problems and the impact of interventions as part of a wider dynamic system. Rather than focusing on isolated or single events, we're interested in looking at patterns of behavior over time. Rather than listing factors that we think are causing a problem, we're trying to understand why a certain behavior is being generated. With systems thinking, we know that causality doesn't occur in a single direction, but is an ongoing process with feedback that we're interested in mapping and understanding. As I said earlier, systems thinking is a bit of an umbrella term for a collection of methods, and you select a particular method depending on what your research question is. Some are more appropriate than others. So for example, if you were interested in setting up a project where you were looking at how community and peer networks affect patient demand for care, you might use social network analyses. If you were interested in mapping patient pathways through the care system, how they access care, how they make decisions, how health professionals make decisions in patient care, you might use process mapping. And then there's causal loop diagrams and system dynamics modeling, which I'll come on to in more detail in a second. If you're just getting started with systems thinking and you're looking for a text that's a good introductory text, I'd recommend the Applied Systems Thinking for Health System Research Handbook. Each chapter of the book covers a different systems thinking methodology with really good examples and clear examples of how they've been used within health systems research. So when I was first starting out, I had that handbook, and I think it's quite good. Great. So when I do these kind of presentations and I'm talking with peers and other researchers, I'm often talking about using causal loop diagrams and system dynamics modeling, as that's what I use in my day-to-day work. Causal loop diagrams and system dynamics modeling together as a collective are often called system dynamics approaches. And we use them to capture and model macro level health system behavior. So the movement of people, finances, resources at a very aggregate high level. With causal loop diagrams, we're interested in visualizing complexity and system structure related to a problem. So with your research question, when you're thinking about using causal loop diagrams, you're often starting from a problem behavior of interest that you're interested in mapping the drivers for that problem. So what is causing that problem in the health system structure? We can use CLDs to map out those drivers. They help us to investigate what causes delays or bottlenecks in health system processes, and they can be developed using a variety of data sources, which I'll come on to later in the presentation. CLDs are great, but they're static maps. So if we're interested in exploring health system behavior over time, how it changes in relation to certain stimuli, then we use system dynamics modeling to fulfill that objective. With SDMs, we can explore how health system behavior changes over time, how different subsectors of the health system talk to each other and pass information, and determining the impact of interventions before real-world application. So you're interested in looking at the likely impact of a policy on key health system outcomes. We can use SDMs to do that kind of in the lab. Although the presentation today is going to be focused on causal loop diagrams, I thought it was important to mention system dynamics models because in the literature, you'll often see them together. So researchers sometimes start with a causal loop diagram where you have that lovely visual structure and you use that as a blueprint to later develop a system dynamics model. So I thought it was important to mention both here. Great. So again, if you're just getting started, I know it's annoying when people recommend their own papers, and that's what I'm doing here, so I acknowledge that. But during my PhD and as part of my work on the COSMIC project, we wrote a guidance paper for using causal loop diagrams for health systems research. So again, if you're getting started with CLDs, you're not really sure if it's the right method for you or you know, what data you need and things like that, that's a really good paper to sort of get you started. It also links to other examples of using CLDs for health systems research. And the paper is laid out to explain what causal loop diagrams are, how you interpret them, when it's appropriate to use them, and some guiding questions for study design as well that you can think about when you're designing your study using causal loop diagrams. So first of all, thinking about when we can use causal loop diagrams. In respect to policy evaluation, we can use them ex ante and retrospectively. When we're using them ex ante, we're using them to inform future design of policies. So you have a problem behavior of interest, I don't know, patient access to care or something is a problem in a setting. We can use causal loop diagrams to map those drivers for that problematic behavior to inform future policy design. We can also use them retrospectively. So a policy has already taken place and you want to better understand what worked, what didn't work so well in that setting, what were the bottlenecks, and what are the recommendations for future health system strengthening programs. So you can use them to look forward and backwards in relation to policy evaluation. They can also be used in conjecture with other methods like systematic and realist reviews. You conduct a systematic or realist review and you want to represent that complex feedback that you found in your results. You can use CLDs to do that. I talk a lot about program evaluation because that's what I'm most familiar with, but it's important to note that they can be used outside of policy evaluation. So looking at how health systems respond to shocks, identifying mechanisms that make a resilient system, and looking at drivers for suboptimal health outcomes like maternal and neonatal mortality. So the first guidance question in the paper is, what is the scope of this research? So what is the time frame of interest for the problem that you're looking at? And what we're saying here is, what period of time needs to be reflected in your causal loop diagram to understand a certain behavior that we're interested in studying. So for example, if you're sitting down and you're talking to stakeholders about a problem or a policy, what period of time are you asking the stakeholder to reflect on and you want represented in your causal loop diagram? Thinking about the boundary of interest as well. What should be included and excluded in your causal loop diagram? What should be represented there and what should be left out? Thinking about the aggregation as well. What level of detail do we need included in the CLD to understand what's driving a certain pattern of behavior? Do we need to include activities that occur on a daily, a weekly, a monthly basis? You'll often do a literature review at the start of your study, and that will help inform these objectives initially, but they're organic. They're going to change as you're talking to stakeholders, as you come across new information and new data, and your knowledge generation is occurring. These elements can change. They don't have to be fixed throughout the entirety of your project. Thinking about the types of data that you might want to collect or source to develop your CLD. There's primary data, which tends to be the most frequent source of data for CLD development. So for example, Sharma used key informant interviews in their study, and Nobani used group model building. With group model building, you're sitting in the room and developing that CLD in real time with stakeholders. With the key informant interviews, you're going to go away later and develop your CLD using some kind of coding analyses to transform your key informant interviews into causal loop diagrams. And I'll come on to that in more detail in a second. Different sources of secondary data that you can use to develop your causal loop diagram. In a recent project that I've worked on, we used previous program evaluation data that was collected in another study, and we repurposed it to develop a CLD. Nigenda used policy, finance, and law documents to develop their CLD, and Namatovu and Senwanga conducted a systematic review that they then used causal loop diagram methodology to represent their findings. Just some sort of key considerations that also came up for me during my PhD in the project, whether to use key informant interviews or group model building. There's a really nice paper that I've referenced at the end of the presentation where they actually did both in one study, and they compared the results of using key informant interviews versus group model building. So that's a really nice reflective paper if you're interested in reading more about that. But also thinking about what's appropriate. So if you have a sensitive research question or you're concerned there might be power dynamics between different stakeholders, you might prefer to opt for key informant interviews to develop your CLD over group model building. Thinking about stakeholder engagement, how are you going to engage your stakeholders in your project, particularly if you're using secondary data to develop your CLD? At what point are you going to bring stakeholders into the project? Is a consideration you should think about at the start. And just reflections on using secondary data for development. Caution is advised when you're using secondary data that wasn't collected for the purpose of CLD development. You might be missing certain causal statements and information because it wasn't, the study wasn't designed to develop a CLD. So you might want to use another method, another data source on top of the secondary data to combat that. So just something to bear in mind. Thinking about how you're going to develop your CLD, we have ex post and real-time development. When we say ex post, we're talking about performing semi-structured interviews at one time point and then developing your CLD at another time point. So conducting the interviews and then using some sort of coding method to go from the key informant interviews to developing your CLD. When we're talking about real-time development, we're talking about group model building, developing that CLD in the room with your stakeholders. You'll see in practice, again, and often a combination of methods can be used. So you might start off by using key informant interviews initially, developing a seed causal loop diagram, and then validating your model using group model building to get that group consensus. I put some examples there, but this is all listed in the paper. This is just an overview. Considerations for whether you might use inductive or deductive coding to extract the information from your key informant interviews. If there's a lot of literature on that content already, you might develop a code book and go down the deductive coding route. If not, you might use inductive coding to develop your code book, to extract the information to develop a CLD. In practice, you'll see a blended coding is used. Even though you might start with a code book to extract your data, you might update your code book as you're reading new information in the key informant interview data set. Thinking about group model building, you don't have to start from scratch with your data collection tools. There are a variety of scripts already out there that you can use and adapt for your project. And yeah, just you can use a combination of methods. You don't have to feel like you can only use one. You use what makes sense for your project. Really important to include a validation step in your study design to ensure that the causal loop diagram that you've developed is still grounded in stakeholder experiences of the problem of interest. Again, particularly important if you're using secondary data as your initial data source. You might think about going and talking to stakeholders afterwards, doing a group model building activity, checking if any unconscious bias has been introduced into your causal loop diagram. That's really important. And then thinking about those stakeholder dialogue conversations, it's really important to pilot your tools. You think that you might get a certain type of data or the conversations are going to go a certain way, but until you pilot them, you won't know. So it's really important to pilot your tools initially, adapt them based on those initial conversations, and then perform data collection. Speaking from personal experience. Great. Just going into a little bit more detail on a specific application of using causal loop diagrams in a project that I've worked on. This was the COSMIC project, where we were looking at how a results-based financing, or sometimes called payment for performance program, was implemented in Tanzania. So we were interested in working out what happened, what worked well, what didn't work so well, what were the policy bottlenecks. We used causal loop diagrams and system dynamics modeling in this project to fulfill different project objectives. With the CLDs, we were interested in mapping those factors that hindered or facilitated implementation of the program. We then later used system dynamics modeling to look at how changes in the policy would result in different healthcare outcomes. So CLDs for mapping and system dynamics modeling to see what happened if we instructed changes in the policy. So using them for different project outcomes. We were also interested in testing the generalizability of our results to another setting, and that piece of work is ongoing at the moment. I won't go into so much of the methodology details now. I can maybe share the paper afterwards, but just to give you a flavor of what we did, we had two data sources. We had primary data, which was stakeholder consultations with people who implemented or participated in the program. And we had a really rich source of secondary data that was collected in a separate project on P4P in Tanzania. That secondary data was interviews with health workers, managers, program implementers about their experiences of the policy that was used in a previous project. So what we did was we first split that secondary data, those key informant interviews from the previous project, into two sets. One to be used for CLD development and a smaller set to be used for CLD validation. And I'll come on in a second what we did with the validation, but just sticking with that development set first. So we reviewed each interview transcript from the secondary data, and we used a method called purposive text analysis to extract information from each interview transcript to turn it into a causal loop diagram. You can think about it like thematic analysis, but for causal statements, kind of. But yeah, it's purposive text analysis is used to extract causal statements from documents. We then developed a causal loop diagram representative of each of those interview transcripts. We then used causal loop diagram combination to bring together those individual causal loop diagrams into one causal loop diagram representative of stakeholder implementers and participants, representative of their experiences of the policy. We then moved on to the validation stage. So that smaller set of the secondary data we didn't use for development now comes in. We compared our CLD to that unseen secondary data source to see if our causal loop diagram was saturated. Are we still finding new information, new dynamics that are telling us about systemic drivers for behavior, or is the CLD fairly saturated? We found in practice, we found some small new informations and nuances, but generally the CLD was well saturated with information. As a secondary validation step, we then went and spoke to stakeholders to check whether the CLD corresponded to their experience of the program. Again, just, we're using secondary data. We want to check that we haven't incorporated any unconscious bias. We're going and talking to stakeholders and checking that it holds up. I realize I'm at 20 minutes. Am I okay to keep talking for another few minutes? Okay, great. Perfect. I've only got maybe 2 slides left, I think. So thinking about the outcomes of this project and the strengths, some really key outcomes for identifying policy bottlenecks. So you have a theory of change about how you think a policy is going to work in practice. You implement a policy, it doesn't quite work as you expected it to. We use causal loop diagrams to look at where those bottlenecks, those potentially unexpected bottlenecks were occurring. I know it's quite small on the screen, but the dynamics represented in this diagram are talking about availability of drugs at facilities. So the policy that we were studying was designed partially to target availability of drugs, to strengthen facility availability of drugs by giving them incentives to purchase medicines. That was the kind of expected pathway to impact for the program, because they already knew that the supply chain was fractured in some places and wasn't performing as it should be. So the policy was designed to address a problem already. What happened in practice and what we were able to present in a causal loop diagram was policy implementation bottlenecks. Why did the policy not work as well as it should have or was expected to? And what we found were 2 things. So one was delays in program payments. So the payments should have been made on a certain schedule. They weren't. This affected service delivery because they couldn't purchase additional drugs. It also affected motivation because people were expecting payments which didn't arrive. That was one problem that was identified. A second problem was the amount of funding. So even when funding was received by facilities, sometimes it wasn't enough, particularly if they hadn't received a shipment of drugs for a couple of months. The incentive payments they were receiving to purchase drugs wasn't enough. So these are the types of findings that we can identify with the CLD, and then start to think about health system strengthening initiatives to overcome those issues. So with payment for performance programs in this setting, it might not be an ideal target to try and support the supply chain structures. That's kind of outside of the scope of this particular policy. But what we can do instead is change the amount of funding that's issued for facilities to purchase drugs where needed. If the baseline assessment is showing there's a clear issue, then maybe we should be allocating further funding. A second finding was program payment timing. Should we change the timing of program payments? Would that improve health system outcomes? That's as far as we got with the causal loop diagram. We then developed a system dynamics model to test those kind of changes. I won't go into that now, but I'm happy to answer questions on it afterwards. Yes, and then thinking maybe about the limitations briefly, some of those I've touched on already. A key one is about stakeholder engagement. We have these beautiful maps that we think are great and are showing a certain level of information. We go and talk to stakeholders, and it's really important that you don't overwhelm them with information. So you think it's really clear what the CLD is showing, and that it's great. You go and talk to stakeholders, you need to be innovative about those conversations. Are you going to show your causal loop diagram in segments? Are you going to use color coding? It's important to make sure the level of engagement and understanding is there between yourself and key stakeholders. Great. And then I just kind of, wrote a couple of reflections from doing the PhD and things like that that came up for me and I was reminded of as I was making this presentation. I've written this like it's a linear process for the purpose of the presentation. It's really not. So you can adjust your study question. Those key variables I was talking about the scope of your project can be adjusted as you go along. With validation, you might go back and change elements of your CLD. So it's very much not a linear path to development. I've talked about the variety of data sources and stakeholder engagement. Really important that we remember that we're not modeling the entire system. We're modeling a problem. If you try and model the entire system, you'll never stop. And it's not helpful either. Your research question needs to be really focused on a problem or behavior of interest, and your CLD is mapping dynamics around that problem. Just to say that it's possible to use a couple of different methods in your project, and validation is really, really important, and you need to make sure that's incorporated into your study design. Great, I'm finished. There were a lot of people, I've talked like I've done all of this alone. I absolutely haven't. There are a lot of people involved in this project, a lot of different institutions involved with different experiences and backgrounds. So yeah, I think I will end it there. Thank you. Thanks for the opportunity to present.
Thank you so much, Rachel, for the very interesting presentation. Personally, I find it really extremely useful, specifically the explanation of every single step in the methodology, which was really, really great to know. But now let me give the mic to my colleague Sabina to moderate the Q&A session. The floor is yours, Sabina.
Thank you very much, Abia, and thank you so much, Rachel, for a wonderful presentation. I'm seeing first questions are arriving in the chat box. Please, if you have any questions to the talk, Rachel, just raise your hand or post your question into the chat, and I will either read it out or you're welcome to unmute when we call you. I'm seeing there are two questions from Matt. Matt, would you like to unmute yourself and ask the questions directly? Otherwise, I will just...
Hi, I'm here.
Hi, perfect.
Hi, Rachel. Thanks for the presentation. It was really great. Yeah, I was just I'm asking questions because I'm working on developing a method at the moment, so they're quite specific, I suppose, maybe to myself. But I just wondered if you'd seen any examples of when a CLD has been developed as a group with stakeholders, and then that identifies kind of critical feedbacks or things you want to explore more. And then you go and look at those feedbacks with another method, such as interviews, and analyze that in more detail to kind of really get to grips with what those critical feedbacks or leverage points in the system are. So that's my first question. And then my second question is, I was really interested in your purposive text analysis. And I just wondered if you can use that for kind of large amounts of literature to extract causal statements about a particular problem. Thanks.
Great, thanks, Matt. So I'll start with your first question. Yeah, so I've seen combinations of methods. So I've seen group model building used with key informant interviews. The one that comes to mind is using key informant interviews first and then using group model building to certify what you found and check that your understanding is correct when developing the CLD. In terms of using group model building and then using individual interviews to kind of hone in on different parts of the CLD, I can't think of an example, but I can have a look. For that paper that I wrote, I collected a lot of different papers and did some data extraction. So it doesn't come to mind, but I can have a look and get back to you. And your second question, sorry, Matt, could you remind me what your second question was?
Sorry, bad interviewing practice to ask two questions. The other one was about the text analysis, the purpose of text analysis, and I wondered whether it could be used to extract causal statements from the literature on, the problem. So if there's lots written on a particular type of problem or event, can you use that analysis to create your causal statements to then create a causal loop diagram? So, a lot of text.
In terms of my own knowledge, I've seen it used for key informant interviews. So I've seen people perform key informant interviews and then use purposive text analysis to extract causal statements. Often it's because you're asking a question. So you ask a stakeholder, what in your opinion, what was causing this issue? And they say, oh, well, this happened and then this happened and this caused a problem. And then you'll say, oh, can you tell me more information about that? And they're kind of inadvertently giving you causal statements. You're kind of probing them for that information. In terms of using purposive text analysis for like a literature review, I guess you can, as long as it's causal information that's representative and then you're applying purposive text analysis to those causal statements. I don't see why not, but I haven't seen it myself. I've only seen it applied to key informant interviews. Yeah.
Thanks very much.
Yeah, no worries.
Thank you. I think next in line, I'm seeing Mu. I hope I pronounced her name correctly. Would you like to unmute yourself?
Yes, thank you. Thank you for a nice presentation. You mentioned these scripts for the group model building, and I was wondering if those are like where I could find them.
Yeah, no worries. I'll make sure there's a reference at the end of the presentation for the website. Yeah. But there's a really cool website called Scriptopedia.
It's the Scriptopedia. Okay.
Yeah. Have you seen it?
Yes.
Great. I think there's an accompanying paper as well that describes how they developed the initial scripts. I can make sure the reference is on the presentation as well. Just for everyone else, in case you haven't seen it, there's a really nice website, which is a host for scripts you can use for group model building sessions. And the scripts perform different activities depending on what you want to get out of your session with stakeholders. So there are scripts for talking about systems thinking and system dynamics. There are scripts for developing a causal loop diagram. There are scripts for validating CLDs. So depending on what the objective of your session is, there are different scripts to do that. I just wanted to underline it in the presentation so that you don't think you have to make them from scratch. They're already available and you can adapt them based on your project needs.
Perfect. I see another raised hand from Asma Mohammed.
Hello. Hi. I'm happy with this presentation because I think I'm in the stage of writing the code, design the causal loop. So I have a very specific question about how you decide this is a leverage point or the bottleneck. Because in the causal loop is like there is a lot of causes and the delay is there's a lot of delay that I can't find, but I was thinking about to make it part of the validation or like I did this it was interview and then I needed to make for the validation. Doesn't happen yet, but I was thinking about they are ranking these variable and they choose, and I have a lot of ideas, but can you share your experience? And I have another question about the exclusion. Sorry, I was exclusion because I see it's not you start by a lot of causal loops and then you join them together, but it's end up by less number of loops. I mean, like the number of the variable getting less, as I see it in the, or just I imagine that. So if it is how you decide the exclusion is not, I know that's a part of the research question, but it's still how much you can say this is really have a lot of impact on the like a main cause and that I cannot exclude it and vice versa. So, thank you.
Great. I'm so sorry. I should have got a pen and paper. Would you mind reminding me of your first question? Sorry.
So how the bottleneck or the leverage point, how you decide these are the leverage points. Yeah, is it validated or no?
Yeah, great question. So for me, for my project, when I developed the causal loop diagram from the secondary data, I then had key informant interviews, follow-up interviews with stakeholders, where I presented the CLD. I talked about the findings and whether anything was missing, and also what they thought the key issues were. So during those interviews, time and time again, the same types of bottlenecks and issues came up within those stakeholder discussions. So even though I could see in the CLD diagram where I thought the key bottlenecks were, the stakeholders themselves were telling me, okay, these were key issues day in, day out of what was causing issues of problem implementation. And I was able to represent that and draw attention to them in the causal loop diagram. So I would say that it was, even though I used secondary data for CLD development, it was very much the stakeholders telling me that these were the key issues. In terms of the ranking, I'm sure that's something you can do in a group model building activity with stakeholders. So if you already have those conversations about what the potential bottlenecks and issues are with a policy, for example, I'm sure I don't use Delphi and stuff like that really in the projects that I work on, but I'm sure you could use some kind of ranking system for what the bottlenecks are. I'm sure that can be done in a group model building activity. I think there might even be a script on it on Scriptopedia. Is that kind of what you're thinking?
Yeah, it's kind of we're thinking more about like ranking, but they are like Delphi. But I don't know about Scriptopedia. I don't know about it, so I will have a look at it now.
No worries, and I'll make sure I'll make sure I put that on the. Sabine, are we thinking about sharing the presentation? Is that possible?
Yeah, absolutely. So I think we can easily share it to everybody who has signed up on our Google Docs. Okay. Yeah. So great. Make sure you sign up if you would like to receive the slides. I see there's a further question from Dr. Rosio. Would you like to unmute yourself?
Yes, thank you and good morning. And thank you for the excellent presentation. It is very useful to try to understand how to build the methodology to bring a very good research. But my question is if in your expectation, a researcher, you have in mind to change the situation if this is the problem, to modify the problem you find, if this is the reality, how you follow up the results of the research, and how the situation or the bottlenecks or the situation you find changes. Really change and sustained?
Great, thank you, Doctor. That's a great question. So in relation to the project that I've worked on, after we developed the CLD and the system dynamics model, we then had a workshop with key stakeholders, including representatives from the Ministry of Health in Tanzania, where we talked to them about our findings or updated them on the project findings as we were going along. And although the policy has actually finished in Tanzania, we're talking to the Ministry of Health about how these findings can be used for health system strengthening in the future, what the relevance is for future policies. And it's actually led to a conversation about a new project with UNICEF, where we're talking to UNICEF about primary care financing. So the findings from our own project, how can we use that to inform primary care funding engagements in Tanzania, and developing actually an extension of our current model to look at, because at the moment we're only looking at maternal and child health, but we're going to be extending our model to look at primary care funding. So we've been in conversation, and even though that policy has actually finished, we're making sure that the learnings from our project are being discussed with the Ministry of Health about how it can inform future policies for health system strengthening in the country. Does that answer your question?
Just a little, because my concern is if you have a very specific questions to answer with your research, this question is in one context, the country, community, the health system, the culture of the population. how this specific and clear question really is related with the capacities and possibilities of this question to receive and change the situation. Mm-hmm. For that, this is my concern at the first time. But I have to look a little bit more your papers and your presentation for sure.
Great. And also just to add, we're also looking at a key concern is about whether these findings are relevant for other settings as well, particularly as you were saying, Doctor, about the nature of CLDs, or that they're grounded in a particular setting. So whether they're relevant for other contexts and other policies. And that's something we're doing as an extension to our project. So we're working really closely with the University of Zambia to see if there are any generalizabilities between the models we've developed in Tanzania and an extension to the Zambian context. And we found that some high-level dynamics are consistent between both settings. But then, of course, the context is different. The availability of funding, where the funding is going, the baseline resource availabilities for human resource and drug availability are going to be different. But we're seeing underlying dynamics hold in both contexts. We're currently writing, it's being led by the University of Zambia colleagues, but we're currently writing a paper on the reflections of doing that process, and whether it's valuable to do that as well when the nature of CLDs are that they're grounded in one context. Yeah.
Thank you.
Yes, thank you for a lot of great questions and great answers. I think we are able to take a last question. And I see Claudia has her hand raised. Claudia, would you like to unmute?
Yeah. Yes, and it's always inspiring to listen to you, Rachel. And I think there is one important point of the research that you've done and that I found personally fascinating. That is the power of mathematics, if you want, to unlock the full potential of systems thinking. Because you've mentioned motivation of healthcare workforce, no? And there are a lot of studies that also include the dimension of trust, for example, towards the healthcare workforce or towards a health institution. So can you spend probably just a few words on the multidisciplinarity of the team that needs to be involved in this and how to take into account these soft system variables into modeling? Thank you.
Yeah, so I hear two questions. So the first one is about the multidisciplinary nature of teams. Really important. So on the project, the Cosmic project, for example, we had content experts. So we had individuals involved in the original study and implementation of the program on our team. We had economists, researchers. We had myself. I have a mathematics, epidemiology, health systems background. So there were a lot of different people fulfilling different roles in our team, but the content experts are highly important, having those on your team from the very beginning. And then your second question was, I've forgotten. I'm sorry.
Soft variables and how to include them.
Yeah, great question. So I haven't spoken so much about the system dynamics modeling work in this presentation, but an example of how we modeled a soft variable, as you were saying, Claudia, is health worker motivation and trust in the program. It came up time and time again in stakeholder interviews that it was really important to sustain this, to have good program outcomes. The problem is how you define that in a simulation model. It's very tricky. So what we ended up doing for that particular dynamic, for example, is I created a front end for the simulation model so that I could experiment with the model with stakeholders and show the outcome of different model assumptions and ask them about them, whether they corresponded to real health system processes. So for example, with program delays influencing health worker trust in the program, I came up with a few different scenarios for potential impact. So do small program payment delays impact health worker trust? And I produced a graph that showed the dynamic of that relationship as being potentially not too bad. Another dynamic I could show is actually even small payment program delays do affect trust, and you need to really try and mitigate them and communicate with health workers on why delays are happening. So I came up with scenarios to help aid that conversation with stakeholders around potential impacts of delays, and asking the stakeholders to contribute what they thought was most likely. And in that case, the majority of stakeholders came back and said, you know, if there's like a 3-month, 2-month delay on the payment, and you're being really communicative with the health workers and the managers, and you're saying, look, I acknowledge there's been a delay, the payment is coming, it's definitely coming, and we feel your frustration, then you can sustain that health worker trust in the program as long as communication is there. If the delay is any longer, then you're going to slowly lose health worker trust in the program, and it's difficult to regain that. So based on those conversations, we're able to create an equation that replicates those dynamics. The soft variables are definitely trickier to simulate, but it can be done.
Thank you, brilliant.
Great, thank you so much, Rachel. I can see some further questions are popping up. Would you feel comfortable with sharing your email address so that if participants have further questions, they can just write to you? Perfect. And I would just like to take the last 2 minutes or so to invite, well, I'm seeing our colleagues from SYSTAC Americas have been joining this call as well. And we've actually started to collaborating on human resources for health, for primary health care across Europe and Americas. And could I invite you, Dr. Rosio, to just share a little bit, introduce yourself and the current focus of the Americas work.
Thank you again. My name is Maria del Rocio Sáenz, and everybody knows me as Rocio because it's a long name. This is the Spanish name, but Rocio Sáenz. I am an MD, MPH. I have a long history in the policy and primary health care because I was a former Minister of Health of Costa Rica, former president of the Caja Costarricense de Seguro Social, who is the major provider, the unique provider of the health services in Costa Rica. Now I am the leader of the Equity Network of the Americas, and also working with the System Thinking Group in Latin America. And we have a group very interesting because most of them are the people who have the grade in health promotion. There are a younger professional. Here is one of those, is Luis Fernando. And we have epidemiologists and the dentists and nursing and sociologists and so on, people in Costa Rica. But also we have working with the several countries in Latin America. And as Sabina mentioned, we select to working in system thinking in primary health and the workforce on primary health because we feel this is the way to really strengthen not only the health system, but try to understand and to bring this approach in the communities. And also we were talking about the indigenous population, about the migration in the region and so on. We are very happy to be here in this workshop and working together with the several of the people working here in Europe. And thank you for inviting me for this very useful and important presentation.
Thank you so much, Dr. Rocio. Over to you, Abir.
Thank you so much, Sabina. Thanks, Rachel, for the great webinar, and thanks all for listening and for your great questions. Please don't forget to subscribe to our mailing list. Yes, our colleague Claudia has been sending the link in the chat, so please take a look. We're going to send you the record, the presentations, and any materials that can help you to be great system thinkers in the future. So please stay tuned for our upcoming events, workshops, hopefully, and wish you all a wonderful, wonderful afternoon, morning, evening, wherever you are. Have a good day. Bye.
Thank you.
Thanks, everyone. Bye.
Thanks, everybody.
Thank you.
Thank you. Bye.